好，我们还有一个人文置业希望战犯，所以有2次的主题牌哈，所以还要再拍一次。好，那没关系，我们继续进行。
And we are going to welcome our guests today. So we are going to take a picture. And the next, our doctor, Wang from Dalin Hospital. He has been here, Dr. Wang, and today he's here not by himself, and he work at Dalin City Hospital at the rheumatology and immunology department and the pain management integration center from Darling City Hospital. And our editors for his brochure is DM is Sizhan's sister. And let's get to know Dr. Wang Sizhan. And that's during the pandemic. The little girl was only 14 months old, and because she donated the dolls and toys with the little patients in the hospital. And after taking good care of the little girl, and the little girl was finally relieved, and she was the whole family was afraid to go out because people are afraid of them to spread the virus. So we sent a supplement to their home to help them out. And let's take a look. When a doctor falls ill, what does the doctor need to do? When it was severe, was ankylosing spondylitis. I felt very painful in my spinal cord, and after the injection and I felt very so much better. And he suffered from the spinal cord pain, and not only the toothache is very painful, but other pain is also causing us to lose the faith in the confidence in the life. And the painkiller is very useful to relieve pain, but it's also making patient to faint. And don't be afraid. The technology is very advanced nowadays. So now we could use the micro, very minimum invasive operation to relieve pain. We use the microcatheter to inject the medicine into the blood vessels. The embolization, and it's very useful. And now let's take a look at this Dharma master. And after I have the traffic accident, and she had 8 of her ribs has fractured. So I felt that I am more vulnerable than a banana, and I didn't want to have I was so afraid to get the operation, and The doctor gave me the high frequency healing treatment for me, and the pain was relief. I am very grateful. And not only stop the acute pain, but also relieving the chronic pain. No matter what kind of pain, acute pain or chronic pain, both of them are very painful and could affect our daily activities. And let's give a big hand, a round of big hand. We like to be with you because you have positive energy. And Dr. Sizhan, year 2023, he share with us through the conference call. And this time I asked him to come. And today he come with his wife and daughter. I asked his wife and daughter and whether they want to appear in front of the audience, but the wife say that she need to take good care of the little daughter, so they will not come up to the stage. And why our activity team came up with doctor? Well, what's the relationship between the activity group and the Dr. Wang Sizhan? And we work at the rheumatology and immunology department at the Dalin Hospital as a volunteer. And I noticed Dr. Wang Sizhan, and we asked Dr. Wang Sizhan to come out to celebrate with us, and we saw him standing by the side, and we asked him to come out, and he said he is not a doctor yet, but now today we are very glad that he's a father now. He's a shy, introvert person, and he is when he is in the hospital, seeing his patient. And taking a look at let's take a look. This is so patient, and he is a person who has a strong empathy. And let's take a look let's listen to his patient's feedback. I have a problem in my painter fascia. So I asked the sister to volunteer. What do I do with my plantar fascia pain? So doctor, she asked me to see Dr. Wang Sizhan. I know Dr. Wang Sizhan told me that I understand how painful it is, but I will try my best to help you out to relieve the pain. And I'm so touched. I'm so touched that Dr. Wang really helped me to relieve my pain. I don't feel pain anymore now. I'm so touched because of Dr. Sizhan's help. Because Dr. Sizhan has suffered from ankylosing spondylitis. He suffered from the spinal cord pain, so he has very strong empathy of his patient who is suffering from the pain into the bone. So today, let's listen to Dr. Wang Sizhan's remarks. We are expecting diary for the Dr. Wang Sizhan's remarks. I love to be with you because you have positive energy. Thank you. Dr. Sizhan from Dalin Hospital. Thank you for the introduction. And in year 2022, I share my experience online. I feel lonely, and today my wife and daughter are here with me. I felt your support, and thank you for inviting me. And city volunteer, the sister X, I shared that she received the injection from me, and she felt no pain at all. Actually, the needle injection is actually you have to suffer a little pain. And so after her sharing, I remind myself I have to be more careful the next time when I see my patient. I help my patient. I shared with the Dharma Master Trainer a few days ago how I engage in this micro embolization treatment for my patient. And as when you feel pain, do you know where the pain come from? We thought that usually we thought that the pain is from our bone, but actually the pain probably is not from the pain. And a lot of time the pain is from our blood vessels. And so we know that the blood vessels are very important to human bodies. Blood vessels is the source of life. When a patient has a stroke in the brain, we need to take the procedure of revascularization. To treat myocardial infarction, we need revascularization. We also need to take revascularization procedure to treat peripheral arterial occlusive disease. Today we are going to talk about pain treatment. On the contrary, with intuition, we ought to use embolization procedure. And let me share with you, Sizhan, 73 years old, patient from Kaohsiung. Her left heel has been aching for 2 months. Where do you feel pain? Here and here, both sides. Where? What about under your heel? Yes, under the heel too. I feel pain, and in the back of the heel. And how long have you been feel painful? And about 2 to 3 months. I share with Master Chen Yan because our volunteer work as a volunteer. They stand whole day long, especially in hospital. So they suffer from the pain in the heel. And let's take a look. We can see, looking at the X-ray film, the spur looks like a hook, rampantly extending into the arch. It looks like the spurs seem to be provoking the attention of the doctor and hinting that the troublemaker as the spur, and the doctor usually would make decision to remove the spur through operation procedure. But a good diagnosis is better to avoid preconceived idea. We take a step back to take a look at the X-ray film to see if we omit any information. And if our attention focus on the spur only, we would omit the important information. And there are a lot of information in the problem in the soft tissue. Despite the spur in the bone, the missing area is the soft tissues where the Achilles tendons and blood vessel located. Because the X-ray's penetration power is too high, penetrating through the soft tissues, doctors are not able to mislead to see they cannot see the condition clearly, and so and if you press at the soft tissue, the patient will feel pain. And how do we how do we make sure that where the root cause is? I examined the volunteers here with ultrasound. The principle of ultrasound works similarly to the echolocation of bats. When the cell pulses reach the soft tissue, they will bounce back, and after the ligamented tendons and vessels will appear. So the Achilles tendons and the abnormal blood vessel information, we see that from the ultrasound exam. We took a further step to take angiography injection, and we can take a look. And I found involute spider veins in her heels. And take a look on the right hand side, as it's after the time, the microembolization treatment. And we use antibiotic mixed up with the contract agent. We inject this mixed agent into blood vessel, and the mixture is only a microcentimeter, very tiny. So we could inject into the abnormal blood vessel and would not affect the normal vessels. And since our blood vessels are like winding like maze, it is a map of blood vessels. We are like looking up on the map while driving a car. We have to look into the blood vessel very carefully. And let's take a look at her. Every morning I stand up, I walk up normally. I couldn't walk normally. And this morning I walk. I don't feel pain, but I feel stiff. After the blocking of the blood flow in the abnormal blood vessel, she feel much better. And the second case I'm going to share with you as a colleague in a city hospital. She injured her wrist while moving a patient. She underwent endoscopic operation to patch up her cartilage. After the surgery, the pain was not relieved. She had an injury in her cartilage. The triangular fibrocartilage complex is a very small piece of structure in her wrist. I had injury in my wrist, and even my hand touch when I want to wash my hand. I scoop up water with my palm and touch my hand. I feel the pain, the acute pain in my wrist. Every morning when I wash my hand, I would have acute pain in my wrist. I was shocked several times every morning when I wash my face. So I have to change my habit to wash my hands with two hands, to change to wash my hand with one hand. I take a lot of painkiller, but it caused my stomach ache. So I stopped taking painkiller. Her experience was this. A lot of patients suffer from the same situation because they feel the life is so hard. If they don't take painkiller, they feel a lot acute pain. But if they take painkiller, they feel stomach ache. And so after she had an operation on her cartilage, the pain was not relieved. That gave us a hint that the root cause is not from the cartilage itself, but it might be from the blood vessel. After our soft tissue are injured, our body would work diligently to restore and repair the structure to grow flesh. Blood vessels need to bring nutrition. However, when we grow adult, the new grown tissue are not as good as the original ones from the birth. No more blood vessels. Proliferation would accompany nerve pain extending into the surrounding tissues of joints. And it would be the chronic pain filled in the joints. And the colleagues, we taken this picture from the colleague who's undergone the treatment. So we inject the fine catheter into the blood vessel. Although the colleague has been she is still wearing her working robes, and because we use her lunch break time to have her going through the procedure. After I learned this new technology, I actually to receive the treatment. She still feel very nervous, although she is very familiar with this cardio catheterization room as where she work, but she still feel very nervous. And this is you can see that the wound after the procedure is very tiny. You cannot even see with your bare eyes, and there might be a little bit of bruise around the tiny wound, and we injected the contract agent into the blood vessel, and we see that the tiny vessels, blood vessels, and we inject the antibiotic into the blood vessels. After the treatment in the past months, after 3 months, after 3 weeks, 3 days, I felt that the pain is no longer there, and I felt very grateful for Dr. Wang Sizhan, and he take good care of me, and he was very mindful and learning new technology and finding new solution to help me. And thank you, Dr. Wang Sizhan. I feel very fortunate to get to know Dr. Wang and be his patient. The pain management and treatment, we don't need to have a big surgery. We could help the patient with minimum invasive procedure. The blood vessel is very fine. Extending the catheter into blood vessel are like going through a tunnel. And we cannot move. And when we cannot move carelessly, we have to move very carefully. And when we are injecting the antibiotic into the blood vessel of the patient, scream out that the patient feel pain. I felt that's good thing because we got to the root, the focal point. And the next one, and let's take a look at the video. Here, and at first, when he came, he felt a lot of pain, and now, after the treatment, and how many percentage of pains you still feel? You still feel? Oh, she feel only 20% at the elbow. And this is a golf elbow. And on the outer side of the elbow, if you feel the pain on the outer side, and we call it the golf elbow. And let's say goodbye to soreness and pain. And last year, and this is at Times Square, the subway at Times Square, it's like a waterfall because the floods in the Times Square. So, and our blood vessel is it's very long. It's like you can extend the subway from the New York Times Square to Tokyo in Japan. And how can our human body are like this water pipe that has leakage. The workers have to spend so much time on Times Square in the very cloudy area to dig a hole to find where the leakage are. and our body is like that. Our our degrade our spur are from the degraded joint, and how are we going to fix patch up and fix the soft tissue? We need to use the ultrasound and MRI, and all these advanced tools are the advanced devices that could help a doctor to diagnose precisely where the root cause are. When I use my hand to write, when I type on computer, I cannot move my thumb, and I cannot turn my wrist. I cannot turn my wrist, and I feel the pain here. I feel the soreness as well as it is swollen, and I have the X-ray, and the fascia was swelled during my wrist. And she prepared more than 100 boxes of meal boxes. After more than 100, prepare more than 100 meal boxes, she felt the pain in her wrist. And we can see that the tendon in her fingers, there's a normal, we found the abnormal situation, the hyperplasia in her soft tissue, in her tendon. So the tendon was pinched up. And how do we relieve her pain? And we can inject antibiotic into the area where she has hyperplasia. From the advancement of the medical field, we help the patient from operation. Nowadays, we help patient with minimum invasive procedure. So the patient wouldn't have to suffer from the operation, and for so long, I haven't been able to wake up in the middle of night because of the pain. Before the injection, I felt pain in my wrist. But after the injection, I felt so much better, so I don't wake up in the middle of night because of the pain. It's just like, let's take a look at it's like a catheter tube. When we go to shop, and now we upgrade from OLED to nano LED. And when we see it with our bare eyes, we cannot see through. But with X-ray exam, X-ray, the penetration power is too high. So we cannot see the bone, but we cannot see the soft tissue through X-ray film. But we can use ultrasound to be able to see the condition at the soft tissue level, and the blood vessel, and the nerves, and the tendon and ligament are maybe the focal point of the pain. And let's take a look at it. She is the owner of a cafe. And she gonna extend her arm. She feel the pain. And can you extend your arm backward and touch your back? What about the other hand? And what about you use both hands? Lift up your hand and take a look at the right hand. She cannot lift up her right hand. She feels the pain in her shoulder. And we see if we use X-ray, we don't see anything. But after we use we see the we see from the ultrasound, we see that there's a calcium rise in her joint, So we use the barber teach procedure to wash out the lime powder from her shoulder joint. And let's take a look at this patient. And now she can extend her arm. And she can extend her arm. And she feels so happy. And she take the cinnamon roll to share with me. And this is her sharing from her Facebook sharing. She had been seeing the orthopedics and the Chinese medicine, and she also seen the physical therapy and also rehabilitation and acupuncture. And she happened to see me, and so we saw a big calcium piece on her tendon. And we feel like a doctor works like a leak hunting engineer. We have to examine very carefully to find out where the leakage came from. And this is another patient who suffered the knee pain while squatting. I couldn't squat down like this before the treatment. But after I squat down, I couldn't stand up, and I feel soreness and pain. But after the injection, I feel so much better. And this is from ultrasound. And we have the injection for him, and he still feel a little pain. So a doctor so after we gave him an MRI exam, and we feel that the pain we found that the pain is in the bone. And so we gave him the injection of a high concentration PRP treatment. And now, see, I can squat down and I can stand up freely. And a lot of doctor can inject, can give a patient injection, but we still need to be very careful and very mindfully to take a look at the a root cause. We need to give the patient treatment from the surface area, and then if the pain is not relief, we need to seek for other treatment. And we have other many options. We could give maybe injection and maybe operation. If we could use injection, we could avoid the pain caused by the operation. And we could also use the radio frequency nerve block precision. And we saw the video that Dharma master who had a car accident, and 8 of her ribs suffered from fracture, and she was she undergone locking bone plate procedure. So she could not move freely. She was like Iron Man. We found under the ultrasound exam, we found her nerve, and so through the radio frequency nerve block, we sent in the electrical nerve stimulation to block a pain nerve. And we cannot tell her that stop moving so that you won't feel pain. She had to live. She had to move. We cannot ask her not to move to avoid pain, so we have to use a radio frequency nerve block procedure to help her. And after our procedure, the first day, you can step down from the bed, and you feel the pain relief right away. I felt I can move freely. I feel great to come to the hospital, and so I feel relaxed. I don't need painkiller anymore, and I don't need to go through the suffering through the operation procedure. I feel great. And we see that very often, and we can go through the minimum invasive procedure to help our patient. And this radio frequency nerve block can also help at the joint relief, joint pain. And I'm a doctor from Dalin City Hospital. I can use many tools to help my patient to relieve pain. Yeah, let's take a look at this PowerPoint slide. And you notice that no matter you feel pain or your friends or families feel pain, after you hear the remarks from Dr. Wang Sizhan, do you feel that you feel hopeful that your family or your friends or yourself suffer from pain? Now you probably can find the treatment that could help you relieve the pain. And we feel grateful. And her daughter and wife, and I asked her, the daughter, do you want to come up to encourage your dad after he is sharing. And I didn't understand what she said, but her mom understand. She said she's willing to come up to support her father. And she kept on eating while her father is conducting the sharing. So she was so quiet. Dr. Wang Sizhan has strong empathy with her patient. He knows how painful the patient felt. And his PowerPoint presentation is so detail oriented. And did you put in the text by yourself? No, my assistant helped me. Dr. Wang is. I had my treatment and my plantar fascia pain. I had injection in City Hospital in Hualien. And now I know there's another place, Dalin City Hospital, I can go. And do you use this pointer? So my hands, I practice my hands because I'm a pain relief doctor. I inject my injection. I have to be very precise, so my hand cannot be shaking. Thanks to Dr. Wang, he's Holmes. Detective Holmes, he detecting diagnose the pain, the root cause of pain. Sister Sizhan feel the pain in the back. For it's been about 8 years. You can come back to see Dr. Wang Sizhan. And Dr. Wang, from Canada, Dr. Wang is humble and is very skillful and is very knowledgeable. His name is Wang Sizhan. He is a great doctor. Thank you, Dr. Wang. You have a strong empathy with your patient. Many GT volunteers are suffering from pain. And so we now know which doctor we need to go to see. And Dr. Wang is young and very skillful and very knowledgeable. And from Mongolia, and Dr. Wang is such a great doctor. He is very mindful to detect where the pain, root cause of the pain, and it's the patient's blessings that there is such a great doctor we are able to see. And do you still feel suffer from the spinal cord pain? My spinal cord pain is under control.